I've seen too many lives lost from heart attacks, and that's why I'm committed to sharing all of this information with you guys today. I wanted to make cardiac and heart health easy to understand. So I've created this heart health guide. You can download it, it's for free, and it's going to be in the link below. What is a heart attack? There's many different types of heart attacks, but today we're going to be talking about the number one type of heart attack that we see and that we talk about. Now, you can have plaque buildup in the arteries of the heart. The arteries, or the coronary arteries, supply blood to the muscle of the heart. If one of these plaques breaks off and causes a complete blockage, that's what a heart attack is. Signs and symptoms of a heart attack, they can vary from person to person, but there are some really common signs and symptoms of heart attacks that most people have. Those include chest pain, usually located on the left side of the chest where the heart is. It can radiate to the arm, the neck. You can have associated diaphoresis, which is sweating, shortness of breath. You can feel fatigued. Some people feel nauseous or may vomit. And so those are some of the most common signs or symptoms of a heart attack. Now, that's not all of them. And so if you're afraid that you may be having a heart attack, your signs and symptoms may be a little bit different, but those are the big ones to watch out for. How are heart attacks diagnosed? So 3 of the ways that we diagnose a heart attack include an electrocardiogram, a cardiac troponin, or a left heart catheterization or an angiogram. So an electrocardiogram, or you may know it as an ECG or an EKG, is when we put stickers and electrodes on the chest and we look at the electrical current going throughout the heart. This can identify an acute heart attack in real time and can change minute to minute. The second test is a troponin. So a troponin is a cardiac biomarker. What that means is it's a simple blood test to tell us if the heart muscle is injured. This is often elevated in the setting of an acute heart attack. And the third, and this is the most classic diagnostic way of identifying a heart attack, is with an angiogram or a left heart catheterization. That is actually an invasive procedure where we go up and we look at the arteries of the heart and we see, is there a blockage that we need to fix, which would be an acute heart attack, or is something else going on? So you may have been diagnosed with a heart attack. And so here are some common things that we do to treat that. Now, remember, time is muscle. So the quicker you get in to seek emergency medical care if you're having a heart attack, the better. That helps us help you save your heart muscle. The most common thing that we do is sometimes we put stents in. Stents basically open up those significant blockage caused by a heart attack to allow the blood to flow more freely down that coronary artery to get the muscle the blood flow that it needs. Sometimes stents aren't enough, and then we may need to use coronary bypass surgery or a CABG. And that's where we actually reroute the blood flow around the blockage that your heart has created. And the last way is if you're not interested in any invasive procedure, sometimes we use medical therapies to treat heart attacks. Although, again, the most common is to really open up those arteries with either a stent or a bypass. So basically, the people who would undergo medical treatment for a heart attack might be someone who's older in age, might be someone who has significant bleeding risk and can't be on medications that we need to keep those stents open, potentially someone with poor kidney function that don't want to risk the kidney function with some of these interventions like the bypass surgery or the stent, and some people who are just too high risk for other medical reasons that they wouldn't be able to undergo either a stent or a bypass surgery. So what are the best strategies to prevent heart attacks? Great news is 80% of heart disease is preventable. And the best strategies that you can use to prevent heart attacks are to make sure that your cholesterol is well controlled, make sure your blood pressure is well controlled, make sure you're not smoking or using any other products such as e-cigarettes, making sure that you're exercising daily, eating healthy, and if you have diabetes, controlling your diabetes. Those are some of the key ways that you can help prevent a heart attack. If you want to learn more about heart health, make sure you subscribe to the channel, and we'll see you next time.